Hello, my name is Deborah Buckner, and I am the director of the Marion County Public Health Department's Substance Use Outreach Services program. The impact of the opioid crisis is vast, with its effect impacting individuals, families, and communities as a whole. Drug overdose deaths, more specifically opioid-involved deaths, have continued to rise in Indiana and impact people of all races, sexes, ages, and locations. The Marion County Public Health Department has been hard at work to create data-driven responses to this crisis. The 2017 rate of drug overdose deaths in Marion County, 37.4 per 100,000, was higher than the Indiana rate of 25.7 per 100,000, and both are higher than the United States rate, 22.4 per 100,000. Like the rest of the nation, drug overdose deaths have increased significantly in Indiana and Marion County in the past 2 decades. More than 1,700 Hoosiers died from drug overdose in 2017, reaching an all-time high. Between 2011 and 2017, there was a 75% increase in the drug overdose rate among Indiana residents and a 123% increase in drug overdose deaths among Marion County residents. The drug epidemic, driven mainly by opioid-involved deaths, has evolved over the last decade in 3 distinct waves: an increase in prescription opioid-involved deaths, a spike in heroin-involved deaths, and a surge in synthetic opioid-involved deaths, primarily consisting of illicitly manufactured fentanyl. Toxicology screens identified opioids as the most common cause of overdose death in Marion County, involved in 81% of all fatal overdoses, and fentanyl was present in 46%. Marion County also has higher rates of hospitalization and emergency department visits for non-fatal overdoses than across Indiana. This may reflect both higher rates of opioid use disorder and greater access to emergency care and naloxone in this urban area as compared to rural areas of the state. Doses of naloxone dispensed by Indiana Emergency Medical Services, EMS, have increased 4-fold since 2013.
Every day we're treating, 10 plus people a day sometimes who are victims of an opiate overdose. So again, really, we're the ones who see it first, we deal with it, we treat them, we stabilize them, and we get them to the hospital so they can get further evaluation. Prevention and access to treatment is critical to fighting the opiate epidemic. That is the next step. We are saving lives. We have naloxone everywhere now, with first responder public safety naloxone combined with layperson naloxone that's available all over the state. I think we've really addressed the life-saving part, teaching people how to recognize an opiate overdose and act accordingly. We're getting in the emergency department, we're stabilizing them there, we're having a conversation about what next steps are. So now we need to move on to treatment and access to treatment. So it's incredibly important that to have that component so that we can really make a difference and not only to build off all the lives we're saving, but start really making an impact on the number of folks who are addicted to opiates and how we can get them into treatment and stop using.
Opioids continue to be the most frequent found substance in overdose deaths. Public health officials, law enforcement, and other stakeholders should also be concerned about polysubstance use and the rise in deaths involving non-opioid substances such as cocaine, benzodiazepines, and amphetamines. The evolving epidemic has compelled an evolving response, including new and more diverse strategies and the engagement of multiple sectors of the community beyond healthcare, including employers, schools, nonprofit agencies, government agencies, faith-based, law enforcement, and policymakers. The United States Surgeon issued a national advisory urging more Americans to keep on hand and learn how to use Narcan, which can save the lives of people overdosing on opioids. In response to the opioid epidemic, Marion County Public Health Department's Substance Use Outreach Services program has conducted 300 Narcan trainings to local community members to date. linked 40 individuals to substance abuse treatment in 2017, and provided the substance abuse funding to those individuals. Without Substance Use Outreach Services funding, these individuals would not have been able to access substance abuse treatment. Substance Use Outreach Services has distributed over 3,000 substance abuse toolkits. The toolkits consist of local substance abuse treatment resources, support group meeting locations, educational tips for parents and families, and other substance abuse resources that individuals and families often are not aware of. Substance Use Outreach Services has partnered with the FaithBased Community and conducted a Narcan Saturday where 50 members of various faith-based groups participated in the Narcan training event.
And to see Marion County Health Department come alongside the faith-based community is extraordinary. And to be able to come on a Saturday afternoon with Saturday morning with such beautiful weather and have close to 100 people come out to hear about how to prevent overdose in their communities is phenomenal. When you look at a program like this, it's really about saving lives, making people aware. What company, what business would not want to contribute into saving a life? You need to be conscious of the fact that this is happening all over the city, happening all over the county. This is not, opiates no longer is a white issue anymore. It's a black issue as well, it's a Hispanic issue as well. It's attacking all ethnic groups. And so we need people to come online, come on board, do what they can to make sure that they can create settings like this all across the city, all across the county, so people can be informed and receive Narcan kits. In case somebody has an overdose in their immediate presence, they'll know how to handle that.
The Marion County Public Health Department is trying to partner with a number of networking organizations in terms of addressing this opioid crisis. And there are several components that we feel we have to address. I think that one, we have to look at issues of poverty and mental health. For example, we have a significant number of our residents who may be homeless, at some point in their life, and so what kind of resources are we bringing related to that? I think we have young teenagers or younger children who may be experimenting, occasionally in their life, and so what kind of education are we doing in our middle schools and high schools to really try to address this issue very early? We need a significant amount of education on college campuses, whether it's fraternities, sororities, neighborhood associations that know the fabric of what's going on in their community. Corporate America, what kind of resources are you bringing to your employees? And so you name it, civic organizations are really huge, that we have to have a broad-based reach out into the community. And we've got to learn one thing, that this is not a criminal issue. This is a health care issue. And if we can address it that way, I think we'll see tremendous dividends in terms of really turning the tide around related to this opioid crisis.
The solutions are multifaceted and range from prevention education to syringe services and the availability of effective treatment options. More needs to be done to save lives. The Marion County Public Health Department is committed to the health and well-being of all the residents of Marion County. This epidemic threatens that well-being, both directly and indirectly. We will work tirelessly to address this challenge head-on, working with all the people of Marion County.